Okay, recording has started.
Thank you. All right. Good afternoon. Thank you for joining the Center for Community-Based Learning as we provide a series of webinars for faculty members on community-based learning in the current environment. My name is Dr. Allery Gibbs, and I'm the curricular coordinator for the Center for Community-Based Learning. I'll be your moderator for today's session, revising community-based learning assignments during COVID-19. Dr. Dan Richard, Director of the Center for Community-Based Learning, will be assisting with this session. If you have any comments or questions, please use the chat to raise your hand, or you can submit a question via the Q&A. Dan will be monitoring these features as we go along. A few polls will be incorporated to guide the conversation and add context when necessary. And we encourage you to respond to those polls. This session is being recorded so that it can be accessed in the future via the virtual faculty lounge. With that said, I'd like to introduce to you our panelists for today. We have Dr. Leslie Kaplan, Associate Director of Hicks College, Honors College, Dr. Mary Grace Amendola, Assistant Professor of Nursing, Dr. Suzanne Ehrlich, Assistant Professor of Leadership, School Counseling, and Sports Management with the College of Education and Human Services. Before we begin these presentations, I'd like to take a quick poll just to get us started. So let's go ahead and launch that first poll. So if you could, please choose a response. What element of your community-based learning course do you anticipate needing the most revision in order to execute during COVID-19? So we can take a moment and I'll let our participants respond. We'll give a couple minutes and then we'll show those results to you.
So we're getting some responses in.
All right. Okay, and we're sharing the results now, and it looks like just about dead even with the activities, assignment, or community partners that will probably need the most revisions. Okay, perfect. Thank you for that. Okay, so let's go ahead and begin with our first panelist, Mary Grace. And let me pull your slides up for you.
Okay.
Share. Right. And just tell me whenever you need me to go to the next slide. Go ahead whenever you're ready.
Oh, sure. So you've already, I'm really happy that I've been invited to present today and share some of my knowledge. I am a community and public health nurse and with the School of Nursing. So you can change the slide. Thank you. So I want to give you some background information first about the community home base and the family community assessment and community partnership courses to prepare our students in the beginning, which is family community assessment, and then at the end with their end product of a project. Also maintaining the partnerships and adapting assignments during COVID-19. Okay, so we could switch. A unique aspect of our undergraduate nursing program is our community service home-based model. It's really an integral part of our program. Now, this program has been in existence for about 16 years. Dr. Barbara Kruger developed this program, and our faculty are on board with it, and I'm so happy to be at UNF with this type of program because that's my expertise and my love working with medically underserved communities. Dr. Kruger has since retired, and Dr. Rausch now is taking the lead. And I also work with her teaching community partnerships and also family. I have a section of family community assessment. So this experiential learning prepares our new nursing students for a successful interdisciplinary practice across the curriculum. And it also helps our students develop intercultural and competence. And it also prepares them to be effective citizens in their future career, meeting the outcomes of CBTL. Now, these are just two of them, but these are the main ones because they do work with different populations of different ethnicities and diversity and race. So we are very fortunate to have the clinical sites that we do. Okay, so we switch to the other. So what guided the development of this model and what Barb envisioned, and when she did read the literature, and there are other home-based programs in the country, but some of them do not last. This one has lasted a long time so far, and we're going to keep the legacy. Very proud of it. So it's a participatory approach with faculty, students, community, doing with, not for. A lot of collaboration. Integrate ourselves into the community versus building our own center and having people come to us. We go to them. So that it doesn't make it difficult because they're these community members and agencies, it's difficult out there working with less resources and so forth. And also creating a long-term sustainable relationship and really partnering with the community. Okay, so we can go to the next slide. Thank you. So this here is community home base in a nutshell. And this is unique to our model. Like I said, there are other community-based programs, but this is unique for the School of Nursing and so forth. And so the first semester is where the students take the course Family Community Assessment. And I'll get more into that. And then the final semester is when they then do their project because they've been there at one site agency for, during their 4 years. And of course, it's theory-driven, evidence-based, participatory, collaborating, and so forth. And we use the ecological framework for it. All right, you can change the slide. I just want to get into my two agencies that I work with, Community Health Outreach Clinic and the Way Free Clinic. The CHO is in Duval County, and the Way Free Clinic is in Green Cove Springs. And this year, I introduced a group of students to go to Green Cove Springs. And also, we also want to make sure that the geographical location is conducive for the students, so they get to choose. And I know Green Cove Springs is a little bit far out from UNF because I drive, it's an hour away. But the students, they wanted to come. So I had the first time I started with undergrads there, and I've been volunteering there like almost 2 years now. So everyone's really happy to have them. And then at the CHO, as you can see, the only thing different that they have is they have a food pantry that our students are also very involved in with nutrition projects and so forth. And they've been getting like anywhere between 300 and 500 people coming for the food pantry. So they've developed some nice projects. And also, I just want to point out that this has been like a long-standing relationship with both of these clinics. So you can go to the next slide. So as I said, the Family Community Assessment course, This is the beginning course so that students can have an introduction to basic concepts and tools for participation in health promotion and prevention. And then we have the community partnerships, where this course, of course, develops more population-focused health concepts and theories. And it is, like I said, a 90-hour clinical practice course. What happens is, in the beginning, they start off with 16 hours, but during COVID-19, we had to cut the hours, and also we had to make different arrangements because we couldn't have, in March, that's when it all started, that we couldn't have students participate at the clinical site. So we had to, do other things in lieu of that. You can change the slide now. So I want to focus first on the community partnership class. As you see, these are the assignments. Now, when we changed to remote was in the fall. I worked part of the summer, but I was teaching something else in the RN to BSN online. But I want to specifically focus on this course here. So both of those courses are hybrid. And we already have the course shell set up, and we do different things that are online that the students have to do. And they used to meet with us in class, but then we did everything through Zoom remotely. So that transition, to be honest with you, was not bad. And because we already had the tools in place. The big problem was the clinical time and maintaining this partnership. So what we had to do is, you can go to the next slide, look for cases, like Dr. Rausch informed me of the different simulations that they did during this summer, but also when we had to begin it in March, it was very nice that we were able to get other simulations, but then she added more to it. So as you can see, that these counted for 2 clinical hours, so they can meet the objectives of the course. And so, like I said, what I want to talk about is maintaining the partnerships. That it was difficult. I'm going to talk from the perspective in March. And at the community health outreach, we had one ongoing project, which was the nutrition project. And then we had another project that was new, was regards to domestic violence. So all of these projects are done with the participation of the healthcare professionals, the staff, even community members. And so they tell us what they need. And so what we did was, we had to really work hard at trying to keep in contact with the partners, CHO. And what I did was, with the students, I assigned them to be the one person be the leader, and we would try to have conference calls with the partners, with the projects. And we were fortunate that we were able to meet a few times because of the fact it began in March and we started school in January. So we had some of the groundwork done, but as we progressed, that's where we were having more difficulty in trying to sustain the communication. So what we did was, I had to also have the students, sometimes they wouldn't respond to the emails or respond to my emails or calls, but we would just send all the information, what we did and how we did it and so forth, so that they could carry on the project themselves with the teaching plan, with all the necessary tools. So then at the end of the project, when it was all completed, we mailed it through the post office so that they would have all the brochures, because we had gone to the Hubbard House. We also had gone to the Hubbard House and before the COVID-19. So that's, and got all the brochures and so forth. But the students, in spite of it all, did a very, very good job with it. And I did also call, I've been calling the CHO and haven't heard from them. But I did, I mean, the administrator, but I did talk to one of the staff members and they really want our students back. So I was very, very happy. And so now we have to wait until our interim director decides if I could send my students back to the clinical site. And they will continue these projects, or if they need new projects, what they think the community members need. We also ask the community members that go there to the clinic. So we just have to wait and see on that. And also, I wanted to talk about, I've been discussing with Dr. Rausch, because we're preparing for the summer. And the summer, for the fall, I'm sorry, I got a little mixed up. It's for the fall. And so FAMCOM, I didn't teach that this summer, but she was talking about how, you can change the slide, I'm sorry, Ilaria, thank you. These are the tests that they have and so forth, and what the FAMCOM course has. So Dr. Rausch made some significant changes, and she was asking me, and I like to put this out there to all of you, maybe to the panel or anybody, any participants. She asked me to think about health education teaching plan that we do, but we used to also do a video with it. And the students would be in their group and they would, you know, they meet at their house or at school, and they do this great video and then present the video in class. So they couldn't do that this time because of COVID-19. So we're trying to think of things to do with that. But everything else seems to be working out fine. And that was the only assignment that that we need some help with. I was first thinking maybe with Zoom that we could probably have them break out in their classroom so they could still, but that'd be hard to do a video. So if you have any thoughts, I would greatly appreciate it. Okay, you can change the slide. Okay, so that's my presentation. If you have any questions and or thoughts, I'm here. Thank you.
Thank you, Mary. I'm going to go ahead and go to our next presenter just in the
Sure.
interest of time.
Sure.
We will have opportunity for Q&A for our
Okay.
participants in a little
Okay.
while as
All
well.
right, thank you.
No problem. For our next panelist, we have Leslie Kaplan. Let me go ahead and pull up your slides. Give me one moment.
Thank you.
No problem. Thank you. One second.
Yep. So I'll start giving some background. I teach a class with 200 first-year students. You're not on the first slide there. 200
sorry.
first-year students who are broken up into 10 to 12 breakout groups, which have 16 to 20 students each. And the breakout groups are organized by the service project. So can you go to the next slide, please? So that's my overview. Yes, and my students are all freshmen and they're from all different majors, which makes it, adds a couple of extra layers of challenge. Next slide, please. So here's the list of the breakout groups on the left-hand side. Each breakout group is assigned to a different part of a very large interlinked service project. So everybody is working to benefit our local population of refugees, people who've arrived in the US as refugees. And then on the right-hand side is the list of different organizations that I've been partnering with. And so you can see that it's a fairly complex thing. What has made me successful in switching in light of COVID is the fact that I've been doing this. This will be my 11th year. And so I'm not just comfortable with all the partners and they're comfortable with me, but I've actually become a part of the ecosystem of people working with refugees in the city. And so I take every effort, make every effort to attend any meeting that I get invited to. I go to support their events and activities. So people see me, so I don't just know the ones that I work with, but I know basically everybody in the city who's working with this, which gives me both the ability to understand the bigger picture, and also I end up coming into contact with people before I reach out to them, asking for them to allow my students to participate. So I've basically been part of this in a fairly deep way for a long time. And so when I need to say, is there still a way to do this? There's a lot of support because they've seen me around for a long time. I've worked with a bunch of them for a long time. And so to my astonishment, I have not had to change the groups at all this year. I'm still doing all of those different things. In fact, I have 2 groups who are doing mentoring at 2 different places and 2 groups who are doing soccer at 2 different places. And so some of them, we've been able to just shift them to virtual. Some of them, because soccer is outdoors, it looks like, at least for the moment, that that's still going to be able to continue. And I've also been able to work with other partners that I don't normally work with, saying, you know, world has changed. Do you have any needs? And that's something that I always do as I go to these meetings that I'm not required to go to. I'm always listening to hear whether there are opportunities where I might be able to contribute, where my students might be able to contribute. And I try very hard to be very generous, even when it's not something that I need. I always try to find opportunities to give back to the community, because what goes around comes around. And so being part of that ecosystem and kind of taking that view of myself as a part of that ecosystem, and understanding that I feel like it's very important for UNF. Of course, my job requires that I'm looking for opportunities for my students, but I see my job as also being an arm of UNF that reaches into the community and is able to help that community with some of our resources. So I'm seeing it as going both ways. So I've done a lot of community-based learning activities and trainings, and one of the things that we've talked about a lot is transformational partnerships. And so rather than transactional partnerships, right? So my job is to get my students these opportunities. That's transactional. I'm looking for something. But under the influence of all of this thinking, I've really tried to have transformational ones where I'm giving as much as I'm getting, and I'm really part of that community and part of the ecosystem. And so when it came time to say, oh my gosh, is there any way to have service projects for my students in this crazy time, everybody was willing to put in a little bit of effort to be a little bit creative to our mutual benefit. Their children get exposure to our students, and they get help giving more personal individual attention to those kids, and our students get the opportunity to extend their learning into a practical environment, and they get some experiential learning. So I think my takeaway from this was how important it is to really be thinking about this in that kind of holistic way, of really working to have a transformational partnership and really learning not just the world of my community partners, but a broader world than that, which allows me to have a broad enough view that, lo and behold, I'm able to do all the things that I'm trying to do, even in spite of COVID. Can you go to the next slide? Yeah, so these last pictures are just pictures of some of the things that we've done. One of the things that I thought, oh, there's no way I'm going to be able to do this, is we always bring the children onto campus and offer them a couple of field trips where we do holidays. So this is our fall holiday. We don't call it Halloween, but it has some Halloween elements to it. You can see the spider web. We invite the kids. Our students dress up. We do trick-or-treating in the dorms. We obviously are not going to bring 50 or 60 or 100 children onto campus to touch everything. But we're going to be able to move our students into a YMCA and do some holiday events for them. Can you go to the next one? We're just going to breeze through these. We're still able to do our clothing drive, so we're still going to collect clothing, and then we're going to set up our little free store and allow the kids to choose some clothing. We're just going to do it in much smaller groups in a socially distanced way. Next slide. Nobody's going to sit this close together and everybody's going to be wearing masks, but again, we're going to move our events from UNF's campus to the off-site places and still be able to do them. Next slide. And soccer, we can still do it outside. I think that might be the last one. Is there another slide or is that it? Yeah, that's it.
I don't think so. Let me stop sharing for a moment.
Thank you.
Thank you, Leslie. Our third and final panelist is going to be Suzanne Ehrlich, and she will present on adapting to a universal design approach for CBL courses or assignments. So you might consider this as sort of a recommendation or a tool you can use specifically for reaching diverse populations. So Suzanne, whenever you are ready.
Sure, I've been trying to mitigate my background noise. So if you hear any, I've done what I can on my end. So I apologize if there's some little people interference. But I'm excited to share, I work in, I'm actually in the Department of LSCSM, but my program is Educational Technology Training and Development, just to give some background as to why. And having participated in, you know, CCBL's work previously, ongoing, have really played with the whole virtual service learning for some time, and looking at how it looks very different from context to context. So when we talk about virtual service learning, it isn't the same in conversation. So sometimes even the language doesn't mean the same to the same person. So some people are very much maybe teaching remotely to their students, and the students are actually placed physically, or sometimes we're talking about remote experiences, which are the digital service learning piece that some have been maybe experimenting with more so. And so really kind of it fits all those frames. But my work is in universal design for learning, a lot around the universal design for learning mindset. And I recently taught a class this summer on teaching, training, learning online in the COVID era. That's right. I took this experience and made it into a class. And I actually had a chance to really think about engagement. So when I think about CCBL and I think about these experiences, much like everything I'm finding, and that what we know about social learning, is engagement is such a huge part of that. And universal design for learning is a framework that talks about different means of engagement, action and expression and representation. And so when I think about what does that look like in terms of what I teach tangibly, how do I recommend to others how they change? You know, we kind of start with different frames, but one is flexibility. And I know that people hear the word flexibility and they think, oh, well, if I provide flexibility, then my students won't do this or that won't happen. But it does come into flexibility in terms of our instructional strategies, not so much in terms of our flexibility that we provide students in terms of, say, deadlines, although that would be maybe another session and another conversation. So things in strategies that I would give kind of concrete examples had to do with just even communication, right? So we have to communicate in these courses through these experiences. And instead of giving maybe, and what UDL would promote is that there are multiple means, right, in terms of these strategies. So my simple example is students, it was suggested that, and I hope I don't get in trouble for saying this, that we do Zoom office hours. So I did a needs assessment, assessed all my students, they all needed different things. So I provided 3 different means of engagement, if you will, in terms of office hours. So I had a chat feature, I had an online video office hour and email, which was the prominent request. And that meant that every student had a way in which to kind of effectively move through the course and communicate. Does that mean a lot of work on me? I actually think it was the opposite. But it meant that there were students who, I had a student who couldn't get to a web camera and was sharing a web camera in her. She's a working teacher, could not have a consistent use of a web camera. And so that meant when we talked about synchronous or asynchronous experiences, when there was an alternative for her in terms of synchronous versus asynchronous, she was very grateful because it meant scheduling in the house with another professional and a child simultaneously. And so one of the other bigger pieces that I'm looking more in, and actually I'm really excited, I'm writing a piece now on virtual service learning, empathy mapping, and critical service learning, empathy mapping, and universal design for learning. And we're at the front of it, so I can't tell you a whole lot yet. What I can tell you is that there are some great connections in terms of those authentic relationships and development of empathy, even into compassion, right? That's some of the new conversation. Not that it's new, but I think that this situation has brought us into a new conversation in a different way, maybe, with some of the same themes. And I'm happy to share a tool if you want to share it out later. And empathy mapping is actually from the world of design thinking. It was a strategy that's been used for a long time and is now making its way into learning science and design. And it's a piece of paper with a head in the middle and a bunch of questions around it. And it says things like, what do they think? What do they feel? What are they doing? What are their pains and gains in life? And doing that action, just doing the empathy map to start before they designed any lesson, before they did any activity that had any stakeholder, a student, an administrator, a community of some sorts, suddenly shifted how they developed those materials specific to COVID, right? So we're talking about the challenges that we're in now, but it could easily be adapted to any context. What are the kinds of experiences, right, that your users, I think that's what design thinking, we might say students or learners or our stakeholders and our community partners might be experiencing. So we're employing that empathy map. And what that kind of calls upon and ties to universal design for learning is the diverse needs of those stakeholders that we're engaged with, that there's no one strategy. There's no perfect puzzle that you can put together to make it all fit. I think sometimes what we know and then a new environment where, there's nothing new about that. There's always been the attempt to take what's our face-to-face traditional model and then transfer it to online. Never fits because it's not the same thing. And so employing some of those different strategies, I think helped even myself, what I learned from my students. And I think the number one that I took from, and I have taken over time and using that kind of iterative feedback, is the multiple options for projects and assignments. Now that's different with CCBL, again, because the landscape looks so different in terms of sometimes they're very individualized projects, sometimes there's very centralized one unit, maybe ongoing, activity or projects that might be employed. So that might look different for each group and maybe not specific. But those are just some of the examples. And I think, with universal design for learning, I could have done a big presentation. I think, one of my areas of research is universal design for mindset. And starting with if the value and the support for wanting to support all learners in an environment isn't there initially, then the deployment of UDL integration is very difficult and kind of clunky. And it's the whole idea that if your kind of overarching goal and mindset starts with how do I then support all the stakeholders and the challenges and needs, maybe through identifying that through an activity like empathy mapping, how do I serve them? Then it becomes more, I think, easily integrated because it becomes more a part of the value rather than and just to kind of, I think, jump back a little bit, I think UDL sometimes ends up in the accessibility category. I always call them kind of cousins, and that they kind of live together and they need each other, but they aren't the same thing. And so they are kind of cohabitate and help one another. So I think there is a history of the two of them working very well together. People who are well-versed in UDL often are well-versed in accessibility because of supporting diverse learners. And so it becomes kind of the whole package. So just kind of doubling back, I think when people hear me say UDL, they kind of think, oh, we're talking about accessibility. And really what we're talking about is once you start getting into universal design framework, you'll find even in CCBL experiences, there are diverse learners in every context and every experience that we have, even if they're not just our students, but they're maybe the students that we're serving, or they're the community partners that we're serving. And how do we think about that on a larger scale? So that's kind of the big and the small, and I have some different examples, but I don't want to, I know you have time, and I could talk forever about the topic, but I'd love to field some questions about it too, because I know that sometimes it's the tangible with the theoretical that make it kind of challenging in terms of that framework. And I always say that UDL is something you commit to over time. It's not something that you can just cut and paste. It's been a lifelong journey, and I learn something new every turn I take with it. That makes me a stronger advocate for my learners. And I have to say I've benefited greatly. So like one tiny little example, video feedback. So now it's my norm. Depending on who my population is, sometimes I'll actually ask students, do they prefer text or video? But a majority, the video feedback that I'm giving continuously in assignments made a massive difference in terms of connectivity and engagement. Just the idea that there was a space to communicate. So there are a lot of, the tools aren't, I always say, stay away from the tools unless you need it, and figure out what your purpose is. And for us, it was connecting and feeling connected. And thanks for, I see, Dan's giving a shout out for that. Video feedback I don't think they knew they needed it until they really needed to connect. And then they realized how fun it was, because there were definitely some very, what was the other term they used? Vulnerability. I think that shifted as well. That created a different dynamic. There were definitely some tired feedback nights when I was giving in spring. And they said, you just seemed so human. It was so nice. So I don't know if that's a compliment or insult, but there was definitely that, and that's course-based, not necessarily CCBL, but just thinking about how the kind of two are next to each other as we move into a new era of, teaching and learning in this time. So, yeah.
Yeah, thank you for that information, Suzanne. At this time, we'd like to move into the Q&A portion of this webinar. I invite participants to ask our panelists any questions that they may have. You can raise your hand and Dan will unmute you to ask your question, or you can type it in the Q&A feature at the bottom. I'll start off with a question, and as you guys are sort of asking your questions, I can stop and pause, but I'll go ahead and do this first one, and then we'll let our panelists all have the opportunity to respond from their unique perspective. So, the first one, where did you start when you realized you were going to need to revise your CBL assignment for the fall, and what were some of your initial reactions? So, and I guess we can start with Mary Grace.
Sure. Actually, like I said, I felt very comfortable because of the fact that our classes were hybrid, and we had a lot of variation of learning activities, like I said, with video or doing group projects and so forth. So that was an easy transition. It's just maintaining the partnerships when we couldn't go to clinical anymore. With that one partnership with the community health outreach, it was pretty difficult to sustain that with them. And I've been calling them over the summer too. I only got to speak to one staff person, but the staff person said they wanted the students back. But that was the hardest challenge. And then that activity that Dr. Rausch, we were talking about for the fall, how to do the video, because that was really nice, but they can't get together because of the fact that they have to be together, to do the video. So Suzanne or Leslie or any of the if you have any suggestions, that's why I put it out there, because we were discussing it, because we were like, oh, try to think of something. Yes.
So I
Yes.
got one. I
Yay.
got one.
Go for it.
So I did a presentation on digital service learning for another university, and this was like the #1 question. And you would think I'm getting paid by them for the last 8 years, but I'm not. I should get it paid back though. But VoiceThread, I have to
That's
say VoiceThread
true.
is still one of the most competitive. Now Flipgrid's doing some new stuff, and they're kind of the K through 12. Blingy, my daughter loves it because you can do emojis. But the VoiceThread's kind of the more, I call it the more sophisticated model in terms of ours. And
Yes.
I know that their digital service learning groups, because of the asynchronous, because you can choose audio or video, that has a very strongly UDL component in terms of
Thank
multiple means of
you.
representation. Our university has a license.
Oh,
So
good.
you just ask CERT about it. I hope they can give everybody access to it, but you create the thread, no one on the other end pays for it. So it's also that free access point, right? So you're not asking stakeholders to pay anything to it. Community members can log on. It's just a matter of creating a live link and sharing it out. You can make it private. And there's a lot of great features, and past this, I'm happy to share more. And I know CERT wouldn't be
Thank you. I've used it in the past at another school, but I didn't even think of it. I'm glad you refreshed my memory. Thank you so much.
And Leslie, did you want to respond to kind of the first question I asked, which is where did you start when you realized you were going to have to revise some things in the fall?
Doc Core and a stiff drink.
All right, it looks like we have a question in the Q&A. Dan, did you want to unmute or ask the question on their behalf?
Yeah, this is a question for Suzanne. And have you used Flipgrid for video feedback? And if you've heard of this tool, we're just interested to learn more about it.
So Flipgrid so everybody's on a race to be the best, right? This is the time in terms of technology tools, and everybody's outdoing each other. So in the world of innovation around technology, we're all very happy people, because a lot of our pressures and demands have right, is the necessity of mother of innovation or invention, right, has occurred quite drastically and rapidly. I would say that Flipgrid is great. No complaints. I think it's very accessible. Florida School for the Deaf and Blind is in terms of an entire group of learners who need very specific accessibility needs, have employed it specifically on a large scale. And the only reason why I push for the VoiceThread is I'll say this, Gallaudet University is the deaf university in Washington, D.C. is using it, and they didn't want to call it VoiceThread because it has a cultural kind of connection that isn't necessarily rooted in their culture, and they allow them to call it MyThread on their campus. So there is no ego in that organization that they must have their name. They just both have worked actively to be reasonable in terms of pricing, in terms of access, in terms of supporting, having really seamless tools that kind of get at the heart of creating community and conversation. So I think they work the same. There's different features to both. So I would just look at what your need is. And I would imagine there's kind of a slight difference in terms of functionality, that one might better serve your need than another. That would only be between the two.
Thank you. All right, any other questions from our participants? Let me give a moment to respond before I go to the next question. Give a little teacher pause. Okay, let me move on to another one. Let me ask Leslie this one. What recommendations do you have, let's say, for faculty that now must revise assignments that they may have carefully developed over years of practice? And then kind of that's the first part. And then the second part, would those recommendations be the same for someone that was teaching for the first time in the fall?
So, so when you're talking about assignments, are you meaning where you're going to send them? Or are you talking about the artifacts that get given back to the faculty members?
Either. I guess I was sort of thinking in terms of a CBL course. And so something they've maybe done over and over, but now have to change a lot of it. So it could be course, assignment, activity. So however you want to approach the question.
So I guess what I'm thinking is that if you are, I'm gonna think about activity. I think that the best way to do that is to basically get rid of all of the things that you thought you were going to do and start fresh and say, you know, and I found this to be very useful when I was trying to pivot in the spring as well as in trying to figure out what I was going to do in the fall. Like, what is the need? Like, what is the need, and is there a way that I can help meet that need rather than how can I reproduce what I've already done? And I think that when I was teaching in the spring, I was teaching a class on food and culture, and my students were supposed to be serving with Slow Food First Coast, which was going to do our, I think, 5th tour to farm, and they were going to go help out at farms. And it was 2 weeks before that thing got canceled. So we trained them, and we were all ready, and we had to go. But I still had something in my syllabus for service. So I thought, like, what can I do? And this is the moment when everything was changing and there was no time, no resources, nobody had the brain power to figure out what to do. So I just sort of said, well, why did I want them to do this service? And I realized that part of it was that I wanted them, my students are freshmen, I wanted them to see themselves as the kind of people who are able to contribute back to the community. So I said, I have no idea where you're going, what you're doing, what your life is like. Find a way to contribute either in your family or your community, because I want you to feel like you are an adult contributing member to your community, and I want you to get used to thinking about yourself that way. And they were incredibly creative in how they did it. And it was really interesting because a lot of them who went home midway in their freshman year back to their old bedroom to do, you know, online learning with mom and dad, were able to shift their relationships with mom and dad because suddenly they said, I need to cook. My class says I need to do something. I'm going to take over the cooking, or I'm going to take over the shopping. And so it helped them to shift their relationship with their parents in a way that was absolutely necessary because they were still trying to be independent at a time when they got shoved back into their childhood life. And so this was a way to prompt them to see themselves differently and to ask their parents to see themselves differently as contributing members. So I think that approach of sort of thinking like, why am I doing this? And then starting from there, and then what need is there that I could maybe fulfill, and just kind of starting fresh.
Thank you.
Yeah, we have a question from our participants.
Oh, yes, please.
But I just wanted to say thanks, Leslie, for that perspective. Sometimes it's difficult to just kind of start fresh, but once we do it, we realize like how valuable it is, you know, just to not be so constrained.
Yep.
But yeah, this question was from Connie Rausch about empathy mapping. And Suzanne shared a link, but Suzanne, I don't know if you want to just talk a little bit about that.
Yeah, I mean, I shared kind of the general approach, and I would say that it's relatively new, but it worked as a very practical activity because when you open that link, you see the document, and my students actually did their own work of, I said, you know, kind of, there are a lot of versions of the empathy map. And I said, find one that works for you or create your own. That was my UDL approach to even the empathy mapping assignment, was you get to adapt this and you get to employ it in a way that you see fit for the project that you're getting ready to deploy. But you must engage. And I have to say that because they did, this is a graduate level, they didn't know about it. They, you know, I need to know more before I do it. And so there's kind of this, it's an activity or an exercise in thinking, because it is, I don't know what I think the hard part for them was that they had not really given a lot of the time and attention in that particular way to how their students, or for some, I have trainers, how their users or their colleagues were thinking. And they had to really take some reflective time before kind of diving into the project itself. And a majority of them did report making significant changes to their design and even their proposed delivery as a result of reflecting with the empathy map. And it seems very simplified. And so they had a choice too to do it either individualized on their own and then come together as a group, because it was a group project, or to do the empathy map collectively. And they chose all different methods and came up with all very different and interesting results and share those out with each other. And that's just
great. Thank you. All right. Do we have any other questions from participants, Dan?
Oh, Connie wants to be unmuted. Oh, no, she said, oh, no need. I'm sorry.
All right. Okay, let's go on to another question. And I'll kind of open this up to everyone. For those that have already revised assignments due to COVID-19, are you pleasantly surprised about the changes, or are you hesitant about your students' ability to meet the goals and objectives? Let's see, I'm not sure who wants to start. Leslie, would you like to start?
I'm sorry, can you repeat the question? I didn't catch it.
Yeah, sure. For the revisions that you've had to make to your assignments or your courses or your activities due to COVID-19, were you pleasantly surprised about those changes? And just kind of describe whether or not you were.
Yeah, I guess in some ways I'm pleasantly surprised. I'm delighted to be able to see how deep and resilient my relationships are with the partners, that we were able to come up with alternatives. But on the other hand, I'm also really sad that my students can't sit shoulder to shoulder with the children, that they're going to be doing it virtually. So it's kind of mixed.
Okay, so let me ask you kind of a follow-up question. Assuming the pandemic is over next year, will you keep the revisions or the adaptations you made to CBL assignments? And if so, which ones?
So I probably will not keep most of them, because I really feel like it's important for people to be face-to-face, and that's mostly what I've done, is I've had to shift away from that. But on the other hand, the pandemic has pushed me to really rethink how I'm teaching in the classroom. So I'm trying to think about how do I allow students who are in quarantine for 2 weeks still participate in my class. And so what we're trying to do is my classes are still face-to-face. And so my plan is to have students bring their computers into the classroom, totally socially distanced, but we're going to simultaneously use Microsoft Teams while we're in the classroom, and we're going to use the lecture capture so that if you're not there, that's fine. You just log on and you can be participating in Teams, you can be collaborating on documents, we can be using the chat, and that I think I will use even afterwards, not because of the ability for students to go to remote, because I still want them in the classroom anytime I can get them in the classroom, but because I think that combining technology into the classroom has tremendous potential to revolutionize the classroom. For instance, when students are trying to talk, one person's talking, 6 people have their hands up, they can be typing in the chat instead of sitting there with their hands up. And then I can then be going back and forth between the voices in the chat, bringing in the voices at the proper time, rather than I'm going geographically around first you, then you, then you, then you, when actually number 3 needs to speak before number 6, and then number 1 needs to speak afterwards. But if I can read what they're writing, you know, if we can be participating more synchronously in a way, but then I can choose which voices to bring in verbally, I think we could actually have a much richer class session. So there are things like that that COVID is bringing that I see as gifts that I will be using in the future.
Great point. Suzanne, kind of the same question. What are you keeping, or what are you tossing?
So it's interesting. I don't know the answer to this yet, but I am very much in the exploration of boundaries because I know that I violated quite a few of them over spring, kind of not knowing. So I've been an online teacher for almost 20 years, and even that experience was completely new. And so there were definitely things that I sacrificed personally for my profession in a way that I had never before. So I think boundaries for them, boundaries for me, in a very pressure-filled situation. And so I'm trying to figure out what that looks like. And that would definitely, whatever comes from it, I think I would then transfer permanently in terms of, you know, the importance. It's not just boundaries like, you know, this time to this time I answer emails. It's really just, you know, how are you vulnerable with your students without burdening them? I think was the trick for me in terms of taking the journey together. I think there's kind of the, you know, finding that perfect balance, whatever that is.
Thank you. Mary Grace, I do want to give you the opportunity to respond, but we have a question from our audience. So go ahead.
I'll just, one big thing for me for nursing is we use clinical for everything. I want to go back to clinical with the students because I want them to have that, you know, that experience and collaborating and so forth, because that's, I want that.
Thank
and
you.
they want it too.
Yeah. Oh, I can absolutely see that for sure.
Yeah.
All right. Dan, go ahead with the next question or the participant.
Yeah, so the question has to do with anxiety within the students. And so many students are having this anxiety around just having to do their schoolwork remotely, financial issues, even possible illness. And so the question is, are there sort of some things that we can do to help alleviate some of that anxiety, or things that you all are thinking about and doing that we can help alleviate that anxiety for students prior to as opposed or in addition to once it happens, right? So once we can always respond to the need once it arises, but are there some things you're thinking about and implementing to help with that student anxiety prior to the start of the course or prior to the presentation of that anxiety?
That's a good question.
Oh, can I answer that question?
Yes, please.
Oh, one of the things that I do, and I like to do it more often, is because I'm a therapeutic touch practitioner, and I usually teach them about meditation, one of my different nursing roles, you know, in community partnerships. And I think I'd like to help them center themselves. And I think doing it for each class, if you know, if Connie agrees, you know, I think that would help them because I've always gotten good feedback with that. It helps reduce their anxiety and also gives them a technique to learn for themselves.
Great, thank you.
Mm-hmm.
Dan, any other questions from participants?
But that's all.
All right. And I just have one final question that I'll open up to panelists. Is there anything else that you'd like to say or add to the conversation that you did not get a chance to speak on? Let's maybe start with Suzanne.
I'm good.
Okay. Leslie?
I'm good too.
And Mary.
Yeah,
Mary Grace.
fine.
Okay. So I believe that concludes the Q&A portion of our session today. I'm going to launch a final poll just to get a sense of how the audience may apply some of the information and recommendations we've heard today. So our second poll, let's go ahead and launch that. In order to achieve the intended CBL goals and outcomes during COVID-19, how would you revise or adapt your CBL assignments for your students? And we have a couple of choices, and I'll give a few moments to respond.
And participants can choose more than one answer if they like.
All right, I think just about everyone. Oh, still going. Okay, so it looks like there's a pretty good spread, but it seems that majority will be adapting to remote learning while incorporating best practices or a UDL approach. And then let's see, probably the one that was responded to the second most, restructure the activity to be more student-centered or action research-based. So those were kind of the big two. And no one put others, so I find that interesting. So most kind of fell within a lot of the recommendations we talked about today. Okay, perfect, thank you. Just a few closing remarks. I would like to thank all of you for attending today's webinar, Revising Community-Based Learning Assignments During COVID-19. I would like to especially thank today's panelists, Leslie Kaplan, Mary Grace Amendola, Suzanne Ehrlich. We're grateful for all your work, and we understand how valuable your time is right now leading up to the fall semester. It is most appreciated. The Center for Community-Based Learning will host the final session of our COVID-19 Summer Preparation Series on next Tuesday, August 11th at 1 p.m. This final session will be an open forum and moderated by our Center's Director, Dan Richard. If you'd like to access the full listing of webinars, listen to any of our previously recorded sessions, or find more resources on the topics, please refer to the Community-Based Learning module in the virtual faculty lounge. CCBL staff are also hosting various one-on-one consultations this week. If you're interested, you can sign up for an appointment using a link that we're going to put in the chat for you. Again, thank you for participating in today's webinar. We look forward to seeing you at our open forum, and please share these opportunities with your colleagues. Thank you and have a good rest of your day.
Thank you.
Thank you
Bye.
very much.
Thank you.